Hello, this is Dr. Brian McDonough. I have a special guest today, Dr. William Strimel. Dr. Strimel is a non invasive cardiologist, but today I'm talking with him about an app he's developed called Care Capture. Now, the app is very interesting. You can actually download it, and it helps you communicate with your physician from a patient perspective and keep those records. But more importantly than that, I wanted to talk to him about why he created it, what he sees the barriers in the present day in healthcare, and where he sees AI helping things down the road. I think you'll enjoy it. We'll pick it up mid interview.
Statistics would show that 40 to 80% of what happens in a healthcare visit, people don't remember. And then of the 50% they do remember, they really don't often remember correctly. And even what they remember correctly, they don't understand. I had this sort of epiphany in the era of emerging technologies, particularly around the rapid advancements with large language models and the interfaces that we're all now becoming more comfortable with in terms of artificial intelligence. So we've developed a software platform called Care Capture. And what Care Capture does is, whether through real-time transcription with your doctor or through integration with any of your health records, you can pull all that information into one place. It can be summarized in a language that you can understand. In fact, even if English isn't your first language, we can put it in the language that you're most comfortable with. And it provides a timeline of the visits that you've had with all your healthcare providers so that you can understand it. You can share it with your family members you can understand, who can help you understand it. And you can even ask questions about it in the context of your own health.
I'm really interested, especially you, because you're practicing as a non invasive cardiologist, why you saw the need. In other words, you didn't just say, oh, I think I'll just invent this platform. It's going to be great. You probably saw there's a real gap here in healthcare.
I've been practicing quite a long time now. And every decade, it seems like the message is, okay, healthcare is so ripe for disruption. Healthcare is so ripe for disruption. We've always heard that mantra. And yet, really, until the last several years, I would say the actual practice of medicine has not substantially changed since the 1970s or 80s, right? It's still basically the same format. And I would say the reason is because the attempts to really, quote unquote, innovate in the past have mostly been around paying for it or regulating it. Okay. And those are huge ships that you're trying to steer. And it's the real problem with healthcare delivery. There's problems with those, don't get me wrong. But the real problem with healthcare delivery is human capital. And it's the fact that we have to be able to change the way that we work together with our colleagues, with our patients, with their families. And that's very difficult to change. It has been, because healthcare is very cognitive intensive. It is highly regulated, and it's very like workflow pattern intensive. I've learned a lot, and I think the three things I would like to part on, because this can be scary. A lot of people are scared about these technologies and how they're going to influence, how is this going to influence me? I think the number one thing is that artificial intelligence is not going to replace your doctor. It's not going to replace healthcare providers. However, I think healthcare providers who embrace this technology are going to replace the ones who don't. So that's a huge opportunity. And I think we should encourage healthcare providers to really be able to feel safe about embracing this. I think the second thing is that the problem with healthcare delivery really isn't the tech. We have the technology. If you really start to see these things that are going on right now, we have the technology to solve almost every problem. The issue is adoption. Right. And so, I encourage listeners to really be open to adopting these new technologies and embracing these technologies, because if we do a good job at adoption, we can solve a lot of problems, and we can even, I believe, start to bend the cost curve in this. And then, I think the final thing I would say is that technology is just tools. The real innovation, and this is, to encourage the physicians and developers out there, the real innovation that's out there is how we take these tools and then use them to make people's lives better.